Today, we'll provide a breakdown of the Charder Body Composition Advanced Fitness Results Sheet. At the top of the results sheet, you'll see your name, ID, height, gender, and more. It's important to make sure user data is input correctly and that you don't have the wrong person's results sheet in your hands. At the top left of this section, you'll see total body weight. Body weight can be broken down into more detail. Let's start with fat-free mass, or FFM. As the name implies, it is the weight of everything in the body other than fat. Adding fat-free mass to fat mass is total body weight. Now let's move to the right and examine total body water, TBW, protein, and minerals. Body water is highly correlated with muscle mass, as muscle is high in water content. As such, it is common for users with high muscle mass to also have higher body water. However, you should observe if body water changes together with protein. Fluctuation in body water is quite normal. If body water is increasing, but protein remains relatively unchanged, then it's possible that increase in muscle weight is partly caused by water retention or other factors. In comparison, protein is generally relatively stable. So, long-term increase in protein is a good sign of long-term muscle mass development. Next, we have minerals. Note that this is the weight of minerals in your body, most of which is contained in your bones. This is not the same as bone density. To the right, you can see reference ranges for a normal, healthy person. Note that they are based on fat-free mass ratio rather than total body weight. Compare total body water, protein, and minerals with this range to place results in context. This section is fairly straightforward and one of the most useful parts of the results sheet. The green area represents the normal range for your height and gender. The numbers on top are percentages based on normal range. The numbers on the bottom are the values that correlate with the percentages. More mass will result in a longer black line, and less mass will result in a shorter black line. The first line is body mass index, or BMI. In other words, your total body weight. The second line is skeletal muscle mass, or SMM. Skeletal muscle mass is the muscle that you use to move your body, which can be actively developed through nutrition and training. The third line is percent body fat, or PBF. For optimal fitness, most people will try to increase skeletal muscle to 110% or over, while keeping percent body fat within the normal range. This section makes it easy to analyze muscle-fat balance and evaluate progress towards your ideal body type. In this example, the skeletal muscle line is noticeably shorter than the BMI and PBF lines. A good goal would be to increase skeletal muscle until all three lines are equal in length, developing the body into a more balanced type. In this example, all three lines are roughly equal in length. If lines are in under, maintain fat while increasing muscle. If fat is already over, try adjusting diet and training to reduce to normal. This is typically the ideal body type goal. If you have already achieved this, the next step is to maintain it. Let's move to the core muscle section. Core muscle refers to the muscles of the abdominal and pelvic cavity that support and stabilize the trunk. The more weight and muscle you have, the more important core muscle is for overall stability and athletic performance. The cross-sectional area for the L4 to L5 vertebrae of the core muscles is displayed in centimeters squared, compared with a standard physique and displayed as a percentage value. A higher percentage reflects better development, identifying relatively less developed muscles to provide targeted guidance and training. The four types of abdominal muscle provided are psoas major, PM. This affects overall core strength and stability. It's one of the primary and most important muscles of the hip flexor, crucial in movements bringing the thigh towards the torso. Erector spinae, ES. This holds the spine upright against force of gravity. Weakness can contribute to poor posture and lower back pain. Quadratus lumborum, QL. This stabilizes the lumbar spine or lower back during movement and at rest. It can help prevent excessive motion in the lower back, which can contribute to pain and injury. The abdominal muscle, or abs, stabilizes the vertebrae during upright position, forward and backward bending, and twisting postures as well. If the core muscle score is below 60, it's a good idea to strengthen core muscles to avoid an increased risk of injury caused by insufficient core strength. Scoring is based not only on the overall development of core muscle, but also on the comparison between whole body muscle and core muscle. A higher core muscle to skeletal muscle ratio will result in a higher core muscle score. Segmental analysis divides the body into the right arm, trunk, right leg, and left leg, and will indicate how much muscle and fat you have in each section. Similar to for the whole body, the 100% marker is defined as the healthy average for that segment according to your height and gender. Common body type goals are to reach or surpass 110% for lean muscle and to stay below 110% for fat. Compare muscle and fat development between different segments of the body to identify relative imbalances and compare with normal range. This is very useful for designing a workout program. For example, if you observe that you have comparatively more muscle in your arms compared to your legs, you can focus your efforts on training your lower body. The same goes for if you have big differences between the left and right side. The muscle balance section helps provide a visual representation of balance. Compare the percentages to identify imbalances. A higher percentage means a relatively higher muscle proportion in that segment. Note that a small imbalance of a few percentage points is fairly normal. The fitness score evaluates fitness-related body composition results, primarily, but not exclusively, muscle, fat, and face angle. A higher appendicular skeletal muscle index, or ASMI, percentile will increase the score. A higher fat mass index, FMI, will decrease the score. Of special note is face angle, which is related to cellular quality. Subjects with similar muscle and fat may not be equally healthy, and face angle is one way to tell the difference. Face angle tends to decrease with illness and with age, and it's an important indicator of your overall health status. If your face angle gets lower and lower, that's a possible sign that your body isn't as healthy as it used to be. Energy expenditure is calculated based on basal metabolic rate, BMR, and physical activity level, PAL. The results sheet provides total daily energy expenditure, TDEE, for sedentary, moderate, and high intensity, PAL. For example, if your BMR is 1,657 kilocalories per day, then if your PAL is moderate, you will use up about 2,354 kilocalories per day. If your PAL is sedentary, such as working an office job, you'll use up about 1,906 kilocalories. This information is important reference data for calculating ideal daily calorie consumption. How many calories should you consume each day? That depends on if your goal is bulking, maintenance, or weight loss. If the goal is bulking, calorie intake should be more than you expend. If the goal is maintenance, calorie intake should be about the same as you expend. If the goal is weight loss, calorie intake should be less than you expend. To achieve goals sustainably, weight gain and loss are both set for gradual rather than rapid change. For someone targeting weight loss whose PAL is moderate, their TDEE is about 2,354 kilocalories per day. In this example, the recommended daily calorie intake for weight loss would be between 1,615 to 1,984 kilocalories per day. Swelling and injuries can cause higher extracellular water ratio, edema, as the body cannot get rid of excess water. How is the edema index calculated? Intracellular water, ICW, plus extracellular water, ECW, equals total body water, TBW. Divide ECW with TBW to receive the edema index. If the index exceeds 0.39 and stays there for a prolonged period of time, it may be caused by various temporary or long-term health complications, and we recommend getting a more detailed health check to confirm if something's wrong. Fat-free mass index and skeletal muscle index are used as ways to evaluate your muscle proportion, following a similar concept as BMI, using height to normalize mass. These are used most often as a way of sarcopenia evaluation. Consistent measurements are beneficial for evaluating progress towards body composition goals. It's recommended to get a scan every 2 weeks, assess the effectiveness of your health or fitness plan at 8 to 12 weeks based on scan data, and continue or adjust training and diet accordingly.